This is a 5-part series. Today, I will go over an introduction to burnout reduction and talk about 14 reasons that it's important for healthcare organizations to develop a burnout reduction plan. For those who do not know me, I am Savannah. I'm a registered nurse. I have a background in public health and nursing administration. I have about 19 years of business experience. I have a bachelor's degree in nursing and a master's degree in nursing. I'm the owner and CEO of Final Draft Healthcare Solutions, and I am the presenter for this 5-part series teaching healthcare organizations how to reduce burnout by creating a healthier workplace culture. And now I'll get right into it. So if you know anybody that can benefit from this information, please be sure to share. Thank you all for joining me. If you are a healthcare professional, specifically a leader in healthcare, you will want to make sure that you grab your pen, grab your paper. There's going to be a lot of information provided. So first, I've had a lot of people asking, how did you come up with solutions to burnout in healthcare organizations? So I want to go ahead and address that first before I get into the content. So most importantly, I've done extensive research on this topic. In addition to my research, my education and experiences have helped prepare me. And in addition to my bachelor's and master's degrees in nursing, I also have a lot of additional training in business and in leadership. I've read a lot of books and a lot of articles pertaining to workplace culture, leadership, burnout, and everything that ties into this topic. I've taken a lot of continuing education classes related to this topic. I'm a member of the American Nurses Association and the North Carolina Nurses Association, where I get a lot of additional information and resources. I actually worked in an organization that attempted to go through a cultural transformation and create a healthier workplace environment. And I got really involved in that as much as I could. I had a course in my master's program at that time. We were given an assignment of an organization that was going through a crisis, and we had to help them get things back in order. So during that time, the organization I was working with was going through a crisis. They brought in a bunch of consultants. So it really helped me to understand more and really develop an interest in this topic. I saw things that they did well in that organization. I saw things that could have been done differently. And it was just a good experience. I actually joined the strategic business planning team at that job during the same time frame. So I was able to see what was going on as far as planning for improvement and how the organization was using the suggestions from the consultants. In addition to that, I've had a lot of valuable conversations with people who experience burnout. And I have personally experienced burnout. I was not experiencing burnout at the time that this series was developed. However, earlier in my nursing career, I did. So a little about my experience with burnout. I relocated to a new city, started a new job. I was really excited. And I started working and people were complaining a lot. And at the time, I didn't understand. So time went on a little bit, and after my orientation ended, my caseload piled up so high and it got overwhelming so fast. But I kept going. I just stayed late at work some days. I tried to make the best of the situation and just learn as much as I could while I was there. On top of that, I was micromanaged. It's really stressful when you're an independent person, and most healthcare professionals are critical thinkers. They're independent thinkers, and a lot of people join the field to be able to use those skills to take care of other people. So on top of that, I had one child at the time. She was starting kindergarten, and my work schedule was 8 to 5, but her school schedule started at 8 o'clock too. And they couldn't be dropped off at school before 7:30 a.m., but I had a 30-minute commute to work. And the traffic here can get real backed up in the morning, especially if there are accidents, if there's rain or anything. So my day started out stressful every morning trying to get there by 8 a.m. And I actually tried to have an honest conversation with the supervisor to ask if I could get a flexible schedule and maybe work from 8:15 to 5:15. Being that I was staying late a lot of days anyway, I was already making up for the time, so it wouldn't have been a big deal for me. But I asked if I could work 8:15 to 5:15. That way I can get my full hours and not have to be so stressed out in the morning on those days that traffic was backed up and I wasn't able to make it there by 8 a.m. But my honesty actually ended up backfiring on me, because even though the organization allowed flexible schedules, they left it up to the department to determine if they would allow their team to have a flexible schedule. And the particular team that I worked on said, no, our schedule is 8 to 5. Everybody works 8 to 5. And there are no ifs, ands, or buts about it, basically. And we had micromanagement. And then on top of that, when I started the job, I expected to be in the community more. It was a home visiting job, and we did a lot of visiting to doctors' offices and hospitals. And I was sitting in a cubicle more than I expected. It was really uncomfortable. I had a lot of back pain because I was sitting in an uncomfortable chair all day. And just all that over time led to burnout. It was really stressful. I stayed in that position for a few years, hoping that things would change, but it pretty much stayed the same. So I eventually ended up leaving there. Thankfully, I haven't experienced burnout since then. So a couple years ago, I just started hearing about burnout everywhere. The World Health Organization had come up with a new definition for burnout and gave details of what it looks like so it could be easier to identify. That was in the news everywhere. It was in healthcare news and business news. There was a lot of articles about it. I saw articles everywhere. They were literally coming to my inbox. Burnout was just following me. Everywhere I went, I saw burnout. And on top of that, old coworkers, current coworkers, friends who worked in different cities, people were just talking to me about experiencing burnout. So during that time when I kept hearing about burnout, I had a lot of ideas about how the issues could be resolved at an organizational level. Most of the literature and research out there, the recommendations are targeted towards individual healthcare professionals, but you don't often see information about how to deal with this at an organizational level. So I had ideas based on stuff that I saw in my experience in the workplace, and differences I saw with different leaders in the same positions, and things that I saw when my organization went through a cultural transformation. And that gave me the idea to write an article. So I started researching evidence to back up the ideas that I had, and I took a continuing education class to learn how to write for publication. So I learned a lot during that time. Also around the same time that I decided that I wanted to write that article, I went to a networking event. And at this networking event, there was a panel of nurse leaders. The leaders on the panel each gave us an explanation of how they reached their positions. So one of the leaders was an executive level leader in nursing, and gave us the whole spiel about how she made it into that executive level position. But at the end of that spiel, she said something to the effect of, so I never want to hear anybody talk about being burnt out, because all you have to do is just move on to another position until you find your sweet spot. So that statement really blew my mind, because I thought that there's no way someone could be that far removed that they think it's that easy. Yes, there are a lot of different areas you can go into in healthcare, especially in nursing. You can do like so many different things, but it's not always easy to get into those roles. Sometimes you have to know somebody. Sometimes they want you to have 10, 20 years of experience, or you're competing against people who have 10 or 20 years of experience. So people often are not able to get into those roles that they really desire to get into. So you have to really tough it out while you're trying to get that experience and trying to work your way into those positions that you desire. And that confirmed that someone needs to teach leaders in healthcare organizations what their staff are going through and how they can address the issue. The history of burnout goes back to the 1970s. I'm pretty sure people were experiencing burnout since way before then, but that's when the term was coined. There was an American psychologist named Herbert Freudenberger, and he was a consultant psychologist in a free clinic. So while he was working at that free clinic, he observed the volunteers there. They were really stressed out and they were experiencing burnout. And he also ended up experiencing burnout when he was working there. So he coined this term burnout, and he described it as gradual emotional depletion, loss of motivation, and reduced commitment to the work. So fast forward several years later, after a lot of people claim to experience burnout, after a lot of research studies, after people realized that this is really a real thing that a lot of people experience, The World Health Organization actually defined burnout and added it to its International Classification of Diseases, which is a database with diagnosis codes. So if someone goes to see their provider and are experiencing these symptoms, they can actually code this as what's going on with this person. And we'll talk more about that throughout the series, but that's just a little bit of background. And the World Health Organization defines burnout as a syndrome conceptualized as resulting from chronic workplace stress that has not been managed. So burnout is directly related to the workplace. People don't experience burnout just because of what's going on in their personal lives. Although people's personal circumstances can contribute to burnout, this condition is specifically caused by the workplace. So there are 3 characteristics to burnout, and you'll realize that these characteristics actually line up with the characteristics that Herbert Freudenberger actually used to describe this when he first developed this term. So characteristic number 1, feelings of energy depletion or exhaustion. Emotional exhaustion is a chronic condition. It's something that happens over time. It results from high stress and excessive demands. And that's something that healthcare professionals experience a lot of. People experiencing exhaustion might appear to be physically tired. They may seem to be mentally tired. They may seem down sometimes. They might dread coming to work. You may see them calling out frequently. But keep in mind, though, that just because someone is exhausted, they may not show physical signs of exhaustion. They may be able to hold themselves together the whole day while they're at work. Characteristic number 2, increased mental distance from the job or feelings of negativism or cynicism related to the job. When people are experiencing this, you may see them become withdrawn from workplace activities. You may hear them speak negatively about the job or even about the consumers that they're caring for. They may not participate in work-related activities anymore and just seem distance from the job. The 3rd characteristic is reduced professional efficacy or reduced professional performance. When this occurs, you may see people making more errors than that person would normally make. You may see them just not performing their best. You may see a decrease in the quality of the work that they're performing. Those 3 things can show that someone is experiencing burnout. Now, it's important to note that burnout can look different in everybody, but some of the common things that you would see people experience are headaches, insomnia, tension, anger, fatigue, impaired memory, decreased attention, thoughts of quitting work, drug and alcohol use, and even suicide. Statistics show that healthcare professionals have higher rates of suicide than the general population, but we'll talk about that more throughout the series as well. Healthcare professional burnout is simply when a person working in a healthcare organization experiences burnout. So you may hear me refer to healthcare professional burnout. It's no different from any other burnout. So risk factors related to burnout. One of the biggest things that cause healthcare professionals to experience higher rates of burnout than the general population is that people who are drawn to healthcare are typically devoted to caring for other people. So they may put their own needs on the back burner for others. An example of that would be working through lunch. Healthcare professionals oftentimes skip their lunch to take care of the consumers. Another risk factor is that performance in healthcare is often rated by data, not by the actual work performed. An example of this would be the documentation in the electronic health record. Healthcare organizations put value on the electronic health record, so this can put stress on people and put them at higher risk for burnout. Goodhart's law basically says that when you use a target to rate performance, then people focus on that target instead of focusing on the actual desired result. So healthcare professionals may put so much energy into what they document in the electronic health record because they feel like that's what they're being judged by, that they are not able to focus on caring for the consumers. And this can cause stress over time because most healthcare professionals actually join the field because they enjoy taking care of people, helping people. And it takes the focus off of what they really joined the field to do and puts the focus on something that they may not enjoy as much. Another thing that puts healthcare professionals at risk for burnout is that a lot of healthcare professionals work in high stress environments. Think about trauma centers, a hospice, or emergency departments where you're seeing trauma, you're seeing death on a regular basis, and you're seeing people who are losing their loved ones, and you're actually involved in that process. that can be stressful, experiencing that day after day. So that puts healthcare professionals at a higher risk for experiencing burnout. Another risk factor is coexisting conditions, especially mental health conditions. When people have things going on outside of work, such as chronic conditions, and then you have to come to work and deal with a lot of stress on top of that, it can escalate that issue. And a couple other things that increase the risk for burnout are lack of social support. That can really take a toll on people, and you never know what someone's personal situation is. So when they come to work and deal with things on top of that, that can add stress. And gender is another risk factor. Studies show that females actually experience burnout at higher rates than males. Burnout reduction is the action or the process of reducing burnout in an organization. So we'll talk about strategies, we'll talk about a burnout reduction plan, and we'll talk about interventions that healthcare organizations can use. For the remainder of this session, I'll talk about 14 reasons that it's important for healthcare organizations to adopt a burnout reduction plan. Reason number 1, burnout has an effect on the entire organization, not just on the individual, because once that individual starts experiencing burnout, the consumers that they care for are affected, all the way down to the organization as a whole. Once you start to look at how it affects the individual and the work that they perform in the organization. And we'll talk about that more throughout the series, but that has a huge effect on the whole organization, especially if there are several people in the organization experiencing burnout at a given time. Reason number 2, without a plan in place, things will stay the same. When you set goals, or if you're trying to reach a certain goal, if you don't put a plan in place, what's the likelihood of you reaching that goal? It's very unlikely. It can happen, but it's not likely. So organizations need to be intentional about developing a plan. Number 3, burnout directly affects the consumers of your organization. When people are experiencing burnout, whether they come to work and try their best or not, you can't effectively provide the same care that you would if you are not experiencing stress. And that's a big deal, because regardless of how you take care of a patient while they're in your facility, regardless of what's documented in the electronic health record, regardless of what the healthcare professional actually did while that consumer was there, the only thing that person will remember at the end of the day is how you made them feel while they were there. You can't give your best care if you're experiencing chronic stress. So you want to make sure that your employees are giving the best care to the consumers of your organization. Reason number 4, that it's important to develop a burnout reduction plan. Burnout is a huge risk to the employee's overall health and well-being. That goes back to what we just talked about in number 3. If they're not healthy, then they can't perform their best work. I'm pretty sure everybody's heard of the saying, you can't pour from an empty cup. That's very true. If you're experiencing chronic stress and your basic needs are not met, then it's hard to perform your best work, especially in high-level work such as healthcare. Reason number 5, when your personal reserves are exhausted, it's impossible to provide high-level care. All of these things tie in together, but to get the full picture, think about if your basic needs are not met, or if you are feeling stressed out, are you able to perform your best work? Are you able to perform high-level work? Are you able to use your critical thinking skills and treat other people the best that you can treat them? It's hard to do. Reason number 6 that it's important to develop a burnout reduction plan. Research shows that there's a positive relationship between a healthy work environment and effective practice in healthcare. There are a lot of healthcare organizations that take care of their employees, and their employees are typically happier and they have better outcomes. Research has actually shown that organizations that provide a healthy work environment have better outcomes. Reason number 7 that it's important to develop a burnout reduction plan. There's a current trend towards healthier workplaces. And that's not to say that you should do it because it's a trend, but your staff are seeing the trends that are happening. And if your organization does not put a plan in place to make things less stressful for them, people will move on to the next place where they feel appreciated and valued and cared for. So if your organization is not developing a burnout reduction plan, there's a possibility that a lot of your staff will start to leave and go places where they are. Reason number 8, that it's important to develop a burnout reduction plan. This can create a better work-life balance for your staff. We'll talk about how later on in the series. Reason number 9, that it's important to develop a burnout reduction plan. Burnout translates into a loss of billions of dollars every year in the healthcare industry. Not millions, billions. The last statistic I remember seeing was that burnout translates into about $4 billion of lost revenue for healthcare organizations every year. That's a significant number. So even though some strategies or systems may cost a little to put in place, it actually saves you money in the long run because you're not losing so much from turnover and errors and healthcare acquired infections. Reason number 10 that it's important to develop a burnout reduction plan. The shortage of healthcare professionals is becoming greater. A lot of people are realizing that it's really stressful to work in healthcare. So I can't tell you how many times I've heard nurses or other healthcare professionals say that they were leaving the field altogether and going into another industry like real estate that's less stressful. Or people are going into entrepreneurship because they realize that they can still use those healthcare skills and do something independent. And entrepreneurship can be stressful, but people want healthy stress. So it's more manageable than the stress that people typically experience working in healthcare organizations. And then if you think about people who are starting their career, people who are going to college, when people keep hearing about this being such a stressful field, less and less people want to go into healthcare, and people are starting to look at things that are not so stressful. Reason number 11 that it's important for healthcare organizations to develop a burnout reduction plan. Health promotion and prevention are way more effective than crisis intervention. We all know that as healthcare professionals, we encourage people to get their annual exams and receive preventive care and eat a healthy diet, because once you actually have something going on, it's harder to deal with. It's the same thing with this. If we work on preventing burnout and promoting healthy behaviors and a healthy workplace culture, it'll be easier than trying to deal with a crisis when you're losing staff or losing funding. Reason number 12 that it's important to develop a burnout reduction plan. Healthcare professionals experience an increase in stress when their employers don't recognize the importance of creating a healthy environment. Studies have been completed, and studies are showing that organizations that actually recognize that they need to create a healthy environment and actually put systems in place for a healthier environment have employees who are less stressed. That's why we're here today, so you can learn how to put some systems in place to create a healthier environment. Reason number 13 that it's important to develop a burnout reduction plan. The number of people in healthcare who are experiencing burnout is about 16 to 50% higher than the general working population. In other words, for every one person in the general population that's experiencing burnout, research has shown that there are about 16 to 50 healthcare professionals experiencing burnout. Talk about significant numbers. That's a significant number, and we need to do something about it. Yes, healthcare can be stressful due to the nature of the work and the things that we see. However, if we put systems in place to reduce that stress, we will see a decrease in stress. And lastly, the 14th reason that it's important for healthcare organizations to develop a burnout reduction plan. Happy employees equal happy consumers. We touched on this a little bit earlier, but this is very true. If your staff are happy and feeling good, stress-free, or not as stressed, then there's a direct relationship to how the consumers of your organization feel when they leave there. So those are the 14 reasons that it's important for healthcare organizations to develop a burnout reduction plan. I hope this information was helpful. As I stated earlier, this is a 5-part series. We are just getting started, literally. This was an introduction to the concept of burnout reduction. Be sure to click the link in the bio to order the full series. Be sure to forward this information to anybody who may be able to benefit from it. If you have any questions, feel free to email me at info@finaldrafthealthcaresolutions.com. Thank you for joining me. I hope everybody has a prosperous and productive day. Until next time.